Everyone, good evening. 227 fresh cases of COVID-19 have been reported in the last 24 hours. This is worrying, and the government is saying that the spike is because people are not reporting on time. But that's not the only worry. Tablighi Jamaat, an Islamic missionary movement based in Nizamuddin in Delhi, has emerged as a super spreader and is being linked to at least 10 out of the 32 deaths that the country has seen so far. It could have ended up infecting hundreds of people across the country. We are still waiting for a figure on that. We know that at least 300 people in Delhi from that congregation are hospitalized. 24 of them have tested positive. We are also waiting for all of you to call us on Zoom. In fact, to Zoom us. If you have any COVID-related question, all you need to do is call us on 0120-434-1895. Let me repeat that number for you, 0120-434-1895. Dr. Arvind Kumar is a chest surgeon at the Gangaram Hospital. He is joining us on the show. Let me just repeat that number for you, 0120-434-1895. Dr. Kumar, Dr. Arvind Kumar, you can hear me now? Okay. First day, we seem to be having a little problem connecting with Dr. Kumar on Zoom. We'll try and fix this line in just a bit. Meanwhile, we have Sunil Malik, who has joined us, and Dev Dhara is with us as well. We just hope, I hope that Dr. Arvind Kumar can be patched up with us, because I will not be in a position to answer medical queries. So Dev, why don't you go ahead first? Till Dr. Arvind Kumar can hear us, just ask us your question.
No, I can't.
Okay, that's Dr. Arvind Kumar saying that he can't hear us. Dev, do you want to still go ahead and ask your question, and we'll try and connect with him?
But it should come direct.
Just a second. I think
it was coming earlier. One sec. Oh, I'm sorry.
Dr. Kumar needs to, he also needs to unmute. He also needs to unmute Zoom. Dr. Kumar, can you hear us now? Oh, some teething troubles. All of us know how to use Skype, but Zoom is a new app. It's very useful, by the way. Easy to connect with friends and family. In this case, these are new times for journalism. These are unprecedented times for journalism as well. Dr. Kumar, good to have you on Zoom. You can hear me, can't you?
Okay.
Doctor. We're just giving Dr. Kumar some instructions on how to get to Zoom. Meanwhile, Dave, go ahead. What's your question for the good doctor? Till Dr. Kumar is figuring out how he needs to get to us on Zoom. What's your question? Go ahead.
Okay, thanks, Shreya. Thanks for inviting us on this show. So my question to the doctor is now the virus has spread to almost every country, infecting more than 500,000 people and crashing economies and broken healthcare system. It has brought countries like, developed countries like US, Italy to the knees and disrupted the modern society on a very large scale. In our country, infected people count is, I think reached to 1,200 plus, and it may be more than that. I'm really doubting the numbers. And due to the lack of awareness, I can see this pandemic can be, more dangerous to our country, and it can, this pandemic can infect a large number of figures. So my question here is so we are a population of 1.3 billion, and we have a very limited medical facility. So how government or the medical force like doctor, which is available right now, is gonna handle all this situation? So being a doctor, how he's gonna handle such a pandemic situation at a pace?
Dr. Kumar, go ahead if you heard that question.
Yeah.
It's a question that's coming from a lot of people, by the way.
Yeah, I have heard that question. And the answer lies in the step which was taken by the government. You yourself started from the example of Europe and USA. Now, in European countries, these are small countries with a very well-developed health infrastructure. We are, Italy is 6 crore. We are 130 crore. Italy has a far advanced health infrastructure than what we have. 60 to 70% of our population lives in villages. Now, if the volumes which Europe is handling at moment, if that kind of volume was ever to be presented to our country, let me tell you, if the health systems of Europe and USA are failing, how on earth can anyone think that Indian health system will be able to match that? There lies the importance of the step which has been taken by the government, that is effective lockdown. Now, Shreya, allow me a few minutes to explain how this lockdown helps. Suppose you have one infected person. In this virus, it is known that one person can infect between 3 to 5 people. So today that one person infects 3 to 5 people, let's say 3. By evening, you have 4 people. Tomorrow, those 4 people infect 3 each, which means 12 more. So 12 plus 4, 16. Day after tomorrow, those 16 infect 48 more. So 48 plus 16, 64. So this is how the number grows. And you reach a stage where suddenly you have a huge number of patients falling sick, presenting to your healthcare facilities. Your healthcare facilities cannot handle the load. They break down. A certain percentage of your medical force starts getting ill. So they are out of the circulation and you go in a very serious situation, which Italy, Spain, and other European countries are facing, and also is occurring in a place like New York, where they have now opened a hospital in Central Park. So how does lockdown help? Suppose today there are 4 infected people, and let's say that lockdown is 75% effective. So 3 out of those 4 are not infecting, only 1 is infecting. So if all 4 were out in the society, they would have infected 12 people. But now with 3 being out of circulation, 1 infects 3. So instead of 12, you have just 3 people being infected. So there is something called R factor, which is called reproductive factor. When you have R more than 1, which means the number of people being infected is more than the number of people who are infected, then every subsequent day you have more and more and more infection and you have an uncontrollable situation. But when you have R less than 1, as China achieved after lockdown in Wuhan, they brought it down to 0.24. So 1 person infects half, which means 2 people infect 1, 4 infect 2. So instead of an exponential growth, now you have a downward trend, and in a certain amount of time, your virus load is controlled.
Dr. Kumar, many questions. Many questions, Dr. Kumar. I think you have explained that concept well. Sunil Malik has been waiting on Zoom with us. He has a question for you as well. Sunil, good evening. Please go ahead.
Yeah. Good evening, Dr. Kumar.
Yeah, good evening.
I wanted to ask one question. I've been news about the cases affected in US and Europe. So the number of cases there are quite high as compared to what we see in India. So is the virus what we have there fast or mutating fast as compared to what we have in India?
Yeah. So very short answer. There are reports which say that probably the genetics of the virus in India may be little different, but I don't think that is the main reason. I think the main reason is when the infection was spreading in their society and the government gave the warning that we need to practice social distancing, people were running in central parks, people were having beach parties, people were doing normal activity, and the infection went on spreading like this. There lies the importance of lockdown.
Okay. Sudeep Sood is all right. Sudeep, thank you very much. Sudeep Sood is with us as well on Zoom. Sudeep ji, please go ahead if you can hear me.
I'm not getting his voice.
Even I'm not getting his voice. Just a minute. We'll try and fix that. Sukhdeep ji, you'll have to fix your audio. We can't hear you. Omkar, can you hear me?
Hello.
Omkar, if you can hear me, good evening. Please go ahead with your question for Dr. Kumar.
Yeah, so I wanted to ask the doctor. So we hear that in India, the number of cases could potentially be high, but since our testing rates are low, the number of cases that are coming up are quite low. So what measures is the government taking to ensure that the testing is maximized?
See, as I said, the most potent method was lockdown. After having done the lockdown, side by side, we have to increase our testing facilities and we have to test more and more people. It has been said that lockdown alone is not going to eradicate the infection from the society. Lockdown will break the cycle of spread of infection. Along with that, we have to test more and more and more people, find them. If they are positive, isolate them and remove them from the society so that they don't infect more people and thereby get this under control. This period also gives us a golden window during which we can ramp up our healthcare facilities so that tomorrow, if we have more number of cases needing hospitalization, we can be better prepared. So across the country, emergency measures are taking place where COVID hospitals are being identified, more beds are being added, healthcare personnel are being trained, their personal protective equipment is being supplied, ventilators are being supplied. All this is happening side by side. So this golden time that we get by lockdown, by reducing the numbers, it gives us the time to ramp up our health facilities, which Europe did not get.
Dr. Arvind Kumar, a very quick question before I take a break. The point I think that Omkar was trying to ask is, why are we not testing enough? What has the WHO said? WHO said test. That's the only way we'll be in a position to understand how the virus is developing. Do we have enough testing kits in India? Because it doesn't seem like we have enough.
So, you see, if you were to go to the point of saying that everybody in the country should be tested, something like South Korea, well, answer is we do not have those kits. But at the same time, it is also true that we are not testing equal to the number of kits which are available for testing per day. So as of today, we are only utilizing, I think, 1/4 of our testing capability. So I think this capability needs to be increased, and whatever is available needs to be used more and more and more. Okay. Especially in light of what has happened yesterday evening, we need to test all these people.
We need to test all these people, and we are going to talk about Nizamuddin as well. But thank you all of you for joining us on Zoom. Dr. Arvind Kumar, we'll see you back on the other side of the break on Skype, because we have a lot of callers who are calling us on our telephone lines. So those are questions that need to be addressed as well. For the moment, a quick break. We'll be back with, if you have any more questions, you know where to call us, 0120-434-1895. You just have to pick your calls in case you have any questions for Dr. Arvind Kumar. We are also going off to our Corona call center, where we have a lot of people who are calling us with questions. So Dr. Kumar will be taking some questions from there as well. A quick break for the moment.